Hello, I am Crystal and this is Jisoo, and today we're going to be talking about how to properly select PPEs for the dental setting. So first we're going to mention what are PPEs. These are personal protective equipment. They help you protect against any hazards or transmissions of bacteria, and these are of various types of PPEs to help you protect various parts of your body. So why are they so important? These are important because they help protect against any chain of infection. In the next slide, you are going to see a diagram of what the chain of infection is and how it gets started. You also need to understand how they can help protect against any chain of infection. So this is just the chain of infection, a diagram of how a disease could be transmitted. And basically, this is just what we use. So PPEs consist of various types of things that could help protect against. So this is just a list, and it's basically explaining what the PPE is and what it could help you protect.
A surgical mask can be marked as isolation, dental, or medical mask. These are disposable devices that are resistant to fluid and provide protection against large droplets, splash, and bodily fluids. However, they are loosely fitted and unreliable against smaller airborne particles. Respirators, they are more heavy duty. The fitting may also need to be done to ensure the mask fits correctly. The filter has a minimum 95 filtration against small aerosols, and very minimal leakage occurs if you wear it properly. So this diagram will show the comparison, the type of mask.
And then we also have gloves. These gloves help protect the barrier against any transmission between your hands. We are going to talk about 3 types of gloves. So we have examination gloves. These are just standard precaution to any prevention against transmission of infections against patients. So these are usually flexible, so they're easy to use for clinicians and examinations. They are disposable and they cannot be sterilized, so they cannot be reused. These are utility gloves. These are more thick and heavy duty. They are reusable and they are chemical and puncture resistant. So these are used for sterilizing, disinfecting, carrying anything hazardous within the office. When you do use these, typically they are sterilized and reused. And then these are over gloves. These are plastic-like thin gloves. So these gloves are to help prevent any cross-contamination. You want to use these gloves when you are trying to get something sterile, or if you forgot something, just to have that barrier between you and your hands to not contaminate anything else. This is just a diagram of the gloves, the different types of gloves, and what they should be used for.
Face shield. Face shield provide a necessary extra layer of protection by covering nose and mouth, eyes, ear, chin, and front of the neck from the contamination. With a face shield, this droplet, which might contain virus, have a dramatically lower chance of entering your body and causing infection compared to just the wearing a mask. So this is just a compare image in what is correctly way to wear face shield. Don't wear like that. Eye protection in our daily activities, splash of blood, droplet of saliva, small amount of mouth rinse or tissue splatter could end up in the eyes, leading to damage or infection. So eyeglasses are used to eliminate these risk of your eyes being splashed or touched during the dental procedure.
And then we have hair coverings. These are basically like hair nets. They help prevent any splatter debris from getting into your hair, so they keep your hair clean. They are typically disposable, but they do have some cloth one that could be washed and reused.
Okay, surgical gowns. Gowns are used to protect the wearer from the spread of infection or illness if the wearer comes in contact with potentially infectious liquid and solid materials. They may also be used to help prevent the gown wearer from the transferring microorganisms to the vulnerable patients, such as like weakened immune system.
And then what is some things we could do to protect against bacteria? Having something as simple as cleaning your nails, having them short, having your hair tied, not wearing jewelry is something we could do to prevent any bacteria transmission. We could also be vaccinated for any disease that has an available vaccination.
Proper hand washing. As you guys are know, proper hand washing consists of washing hands twice 20 seconds a day, each before you start working and end of workday. Hand washing should also done in between patient and when hands are solid. Make sure to scrub in between fingers and wrist area.
And then why do we wash our hands? We wash it because we want to stay clean, and you have to wash them when you are going to eat, touch your face. When you've touched something, you just want to clean that basically contamination you have touched with your hands.
So nicely tie hair up to help prevent any debris may come splattering onto you. And it also good to show you look good as a professional.
And then no jewelry. You don't want your jewelry to dangle over your patient. So a long necklace or earrings, those are not commonly used. You also don't want any rings. Your rings could get contaminated as well. So in this slide, we have short nails.
Sure. When nails are painted, artificial or long, they can create a living environment for bacteria to live. So nicely trimmed nail can help not create a living space for bacteria.
And that is all. If you have any questions, feel free to contact me or Jisoo. Thank you.